Alzheimer's disease. It is a devastating diagnosis and one that is very difficult to diagnose early in the disease course. Hi, I'm internal med doc, a board certified internal medicine physician, which means I've got a lot of seniors in my patient panel. Some of them I've diagnosed with Alzheimer's disease. Many of them I've been taking care of that have a previous diagnosis of it. Here are some signs and symptoms to watch out for. Now, most people think of memory issues when it comes to Alzheimer's disease, and yes, that is a classic feature. The key thing is it's a difficulty remembering new information. Can't retain information, and one of the behaviors we notice is repeatedly asking the same question over and over. Next, we think about executive function, which means kind of day-to-day life stuff. Balancing a checkbook, paying bills, making appointments. Starting to struggle with those types of things can be an early sign, and performing sequential tasks, having to do two or three things in a row, and struggling to keep up with a short list. Next, people may notice language difficulties, having trouble forming full sentences, difficulty in word finding. Next is a vague one, poor judgment. The way I think about this is if grandma or grandpa has typical behaviors and makes sensible decisions, suddenly that behavior changed. They're making decisions that don't make a lot of sense or goes against their known personality. Worsening mental health symptoms can also be a sign. Worsening depression, acting more isolated, increased anxiety, increased agitation. Getting lost is also a symptom that can be picked up early on. Most seniors may have a routine where they drive to certain places, whether it's the doctor's appointment, their family member's home, and they start getting lost in those routine routes. Another general perspective on this is a decline in the day-to-day life maintenance type of activities. If they're normally very independent and organized with chores and household activities, suddenly those things start falling apart. The house gets messier, things get forgotten. Coming back to the memory symptoms, one question I have been asking more lately, and there's some evidence behind this, is asking about the name of their grandchildren. Most grandparents are very close to their grandchildren. They remember them, of course they love them very much, but when you start forgetting names of their grandchildren, that can be a clear sign something is wrong. Now, most of these symptoms that I mentioned are pretty vague and non-specific, and they can be of varying degrees of severity. So individually, if you just have one or two of these features, that may not indicate that you have dementia, Alzheimer's type, but if you've got several of these features going on at the same time, there's a high probability that that could be what's going on. Requires more testing and evaluation.